Okay, this is my catheter continued. The card was full on the camera, so we had to erase some things and start over, so my apologies for that. So I have my my stuff open at this point, and I'm going to uncover Miss Jones, grab the drape out of here.
That's what it does. Wait, no, literally? No, he wrote it. Oh, okay. Well, I don't know. You never know. Not to get a hard on.
Take it, wrap it around, and slide it underneath her. Next, I'm going to pull out my sterile gloves and put those on. Pull it out, pinching first and keeping my hands above my waist. Grab this one. Slide that on, and then I'm just going to get rid of that by pushing it off of there. So then I'm going to come into my kit, and actually this drape is not needed, so we're just going to toss that aside, dropping it into the garbage. Get my supplies ready. Put this off. So this is my lubricant. I'm actually going to take it, pull the cap off, drop that into the garbage, and I'm actually just going to squeeze it into the side right here. And we're going to take that and throw it into the garbage. Put this off of the catheter. Throw that away. And then we're going to generously lubricate the tip of the catheter. Like so. And then we're actually just going to leave the tip right in the lubricant there. Next, I am going to take my syringe and make sure that it is filled with 10 cc's of saline. That's how much the bulb requires on this one. Throw the cap of that away, and then just place it onto here for later. Going to fluff up my cotton balls. Take my specimen cup, set that aside for later. Going to open my iodine, pour it all over my cotton. Throw this away. We did not check, or we're not going to check the bulb with the saline because it is a bare, however you pronounce that type of catheter, and we don't want to check the bulb with that one. So next I'm going to take this, set it up here, bring it back to the center. And then I'm going to pinch this up, touching only what is sterile. My assistant's helping me with her position a little. Set that right in here. So next I am going to take my cotton balls full of iodine and clean her labia area. So I'm going to take one, clean one side, front to back, starting at the outside. Throw that one in the garbage. Take another one, clean the outside, front to back. Throw that in the garbage. Then we're going to clean down the middle. Throw that in the garbage. And we can or cannot use all our cotton balls, depending on what's needed to be cleaned. We're just going to use them all. Clean that and discard of that. So I'm going to take this, Set it aside. And next I am going to take my lubricated catheter tip, and I'm going to use my other hand to hold open her labia. And I'm going to insert tip of the catheter about 2 to 3 inches, or until I get a urine return, and once I get a urine return, about an inch further than that. So then I'm going to hold that with this hand and pick up the syringe and insert all 10 cc's, or milliliters. Once all that's inserted, I'm going to keep my hand here and use my other hand to just gently tug until I feel a resistance that it's in place, which it is. So then I'm going to come down here and remove this, throw that away. I'm going to pull my bag out of the box. And all of this stuff would be going into the garbage at this point. I'm going to unwrap the bag, being careful not to pull on any of her tubing.
Yeah, I'm ready.
Pop open both of these sides and just bring it down and hang it on her bed, which there already was one, so I'm just going to move that. Hang that up. And then I'm going to grab her leg strap.
Keep them in here. She yells at you. No, that lady over there yells at you. The other lady doesn't.
Put it around her leg, making sure that it's not tangled or twisted underneath. Put it on so that it's snug. And hook this up to it, making sure that she has enough slack there that she can move around and it won't be tugged on at all. So after that is done, I want to come over and grab my wet washcloth again, wrap it around, and I'm going to clean all the iodine off of her labia, starting on one side, going front to back. This does not want to stay, but just flip that around. And go on this side, front to back. I'm going to turn that around and clean down the middle, holding her tube so it doesn't pull. Front to back. This will go in the dirty linen. I needed another one with soap and water. I want to make sure that her tubing is clean as well from any iodine. I'd put that one in the dirty linen as well, and then grab a dry cloth, fold that up, and we're just going to dry each side. Spin that around, dry the other side, then inverting it so we have another clean side, and cleaning down the middle. Then that would also go in the dirty linen. All of this stuff would be in the trash somewhere. Not in our way. I'm going to take off my gloves. Covering Miss Jones back up. Making sure she's in a comfortable position. And I'm going to lower her bed back down to the lowest position. She said she's comfortable with her head up a little bit. Then I'm going to document the whole procedure, how it went and everything I used. Perform my hand hygiene. And that's it.